asked to look at this hip and lower extremity flexibility video because you have an issue in your hip. We've talked about femoroacetabular impingement, which you have the cam and pincer impingement lesions. They create tightness in the capsule, and that leads to pinching in the hip. Even though you have a cam or pincer impingement and probably a labral tear, we can hopefully treat this conservatively through stretching. Because when you think of the cam and pincer, they're extra bones that form on the femoral side or on the acetabular side, and it ends up pinching, and that is what causes tears in the labrum. What we need to do is we need to mobilize that capsule. And so this would either be pre-surgical in hopes that you could avoid doing the surgery, because even if you have a cam or pincer or a labral tear, you can sometimes coexist with it. So we really want to see whether we can treat it conservatively, because it's a surgery and you don't want to go through it if you don't have to. So one of the exercises that I do is called the warrior pose. It is a yoga pose. I do it 3 different positions, and I'll describe it as I do it. We're trying to stretch out the anterior part of the capsule so that the ball will rotate through and not end up pinching. So first you put the affected leg back, and you're going to do 3 different positions with it. One, it's going to be externally rotated, 1 neutral, and 1 internal. What that does is it affects different parts of the capsule. With my hip externally rotated, I'm going to bring my unaffected leg forward, bending it forward, and I'm going to put stress on the capsule here. With my foot externally rotated, it's going to affect the internal part of my capsule. And so we're going to be stretching that first. You need to go as far forward as you can so you get that pain associated with it. A little pain is good because that's stretching the soft tissue, so it'll decrease the pinching inside the hip. I'm then going to force my pelvis down to the ground, and we're trying to keep balance, but you got to feel it on the inside aspect of the capsule. When I get better at it, you might need to hold on to something so if your balance is off. But as you get better at it, I want you to start to lean back and eventually get your arms overhead, and you're really going to feel that painful stretch on the interior part of the capsule. So I personally have a labral tear, and I do this twice a day. If you're really affected by it, you can do it 3 times a day to really soften it up. But I do that position, 30 seconds, then I go neutral, same thing for 30 seconds, and then I do it internally rotated, forcing the pelvis down and really leaning back into it so that we can really get that flexibility to that capsule. And even after just doing that, it feels like my capsule is looser. So that's one of the warrior pose stretches that I want you to do for the hip tightness. And this would be number 1, preoperative, to see if we can avoid the surgical intervention, but especially postoperative, because when we do the surgery, we release some of the capsule, and that can heal in with scar tissue. The scar tissue will affect you significantly, and it'll give you more pain. So immediately post-op, I want you starting to do those exercises. Obviously, it's going to be a balancing act because you're immediate post-surgical, and so you're going to be in pain from that. But we want you to start early and progress slowly along. We're also now going to talk about some of the other lower extremity stretching exercises that you can do, because they're all connected. So in addition to the iliopsoas and the hip capsule, I want you to stretch out your quadriceps as well. A lot of the muscles get very tight, and so with a tight quadriceps, you get more patellofemoral issues. And so we really want to stretch that. One of the tightest muscles in our body is the hamstring. And if you have hamstring tightness, then it overloads the quad, and you end up getting more kneecap problems. So we're going to be telling you to do these things so that you can increase the flexibility and not have any further injuries, because the last thing you want to do is get surgery. So one of the ways to do it is you stand close to a surface where you can balance yourself, and then you're going to bring your leg back up. Now, some people will say that they're stretching when they're like this, but it's not. The quadriceps crosses 2 joints. It starts on the pelvis, goes across the hip and across the knee as well. So if you're flexing the hip while you're doing the quad, you're really not stretching it. So you have to focus on getting that leg all the way down so you're extending the hip while you're flexing the knee. When you stretch, you want to hold it for a long period of time. You don't want to just do a quick stretch because the muscle doesn't have the ability to accommodate that. So it'll just tighten up and not really give you that stretch you want. So you want to slowly hit each peak, and then you can even pull back a little bit and then get it further. It's called PNF stretching. You want to do a little bit of resistance to it so it stretches the muscle out, and then it enables you to go even further. And this is something that you hold for 30 seconds, 45 seconds, even a minute to really get the flexibility with it. Fast stretching is not a good thing to do. So that's the quadriceps. You do it both sides. You do the iliopsoas and the hip stretch both sides as well.